Welcome back. Time now 8:42. Well, winter is here, and chances are you know someone who's battling a cold or maybe even the flu.
So this morning we're joined by Dr. Rosemary Olivero with Helen DeVos Children's Hospital with tips on what to look out for when it comes to RSV and also bronchiolitis. You corrected us with that. Thanks for being here.
Yes, you're very welcome.
Yes. So first of all, we've been hearing stories in the news about RSV. I know we've hit on it multiple times, but if people have never heard of it before, what is it and what is bronchiolitis?
Right, so RSV is a virus, and the term RSV stands for respiratory syncytial virus. So a lot easier to just say RSV.
Okay.
So this is a virus that's very commonly spread during the winter months, mostly between children, but also between older kids and adults as well. And it's a virus that can cause the common cold in an older child or an adult. They might not think very much of it. But when RSV becomes really concerning is when it infects a young child, so someone who's less than 2. And the reason that it's such a concern for a little child is that the virus really targets the lower, tiny little airways in a baby. And because those airways are so small, if they get inflamed, it's really easy for mucus to plug in there, and it makes it very difficult for them to breathe.
Yes,
Okay.
yeah. So what are some things that we can do to prevent that from passing on to kids, especially this time of year when you're with family and friends, a lot of people?
It's a very contagious virus, and really we go back to our old wisdom about washing hands, and that is definitely true when it comes to preventing RSV. So RSV is spread by direct contact with somebody who's touched their infected secretions, so usually from their nose or their mouth, and it's very easy to pass just by touching other people. It also can live for a long period of time on toys or commonly touched household items. So really washing your hands and doing your best to clean those surfaces before you touch young children is especially very important.
Yeah.
Okay, and have you guys been seeing more cases this year compared to past years?
Yeah, I would say that it's on par with prior years. The season changes year to year depending on temperatures and how the virus spreads through the country. But for the past few years, December is when the season starts, and then it usually goes until March or April. We started seeing cases a little bit early, maybe right after Thanksgiving, and December has been a really, really big month for RSV in our hospital.
Now, when do you know that you should actually start, bringing your children in to be checked out? When do you have to really seek that care?
That's a great question, and one that a lot of parents have questions about because a lot of their young children get sick a lot.
Yeah.
And a common cold is something that a child may experience 6-10 times a year. So when we're thinking about RSV and when is it time to start being worried that your child has it and needs medical care, it's really paying attention on how your baby is breathing. So if the breathing ever seems labored, or they're struggling to breathe, or if they're breathing very fast, those are reasons to go see your doctor. Also, when I say like labored breathing, that means that your baby is using other muscles to try to breathe. So if you notice their belly's moving in and out, or if they're pulling in their skin in between their ribs to breathe, that shows they're really having a hard time catching a good breath, and you should bring them in to see their pediatrician. And obviously, if you're worried that this is emergency, go straight to the emergency room.
Wonderful tips to keep in mind around the holidays. Absolutely.
All right,
Thank you so much for coming in.
Thank
Now.
you.